some degree it spirals. Now outside of the tunica media is the adventitia. And that adventitia now is composed primarily, as we can see, of just loose connective tissue. Okay? And we may encounter, for example, these are some little minute nerves here. There's some little minute nerves all around. This is nerve here. Okay, so we see a lot of little nerves going around here, because we remember that what? These vessels are going to have around them peri-arterial sympathetic plexus. So around many of the vessels we are going to find these postganglionic sympathetic fibers. And these postganglionic sympathetic fibers are going to be what? Vasomotor. These are what are going to control the tone in the vessel. Okay? So they are small sympathetic fibers, postganglionic sympathetic nerves that we see sometimes in the just outside in the loose connective tissue. Alright? So whenever you dissect off a vessel in the cadaver, that's another little nerve there. Whenever you dissect a vessel, you'll find that you strip off a little feltwork around it, and this feltwork is composed in part of a sympathetic plexus. So the sympathetics tend to travel, or they not tend to travel with the arteries. Okay? So this is a nice medium-sized artery. Now when we compare this with the aorta, alright, so let's take a slide of the aorta up right here. You'll see that becomes a little more complex. Okay, so this is fat. So there you see a lot of fat beside it, and there you see the aorta. Okay, a bit of a slide it a little more, dust it off a bit. Alright, but this is an example here, beautiful, of an elastic artery. Okay, and immediately what you're seeing are many what would be just replicates of the internal elastic membrane. I should have pointed out to you, forgive me, that in the tunica adventitia, we didn't see it in the other vessel, but in the tunica adventitia, we also encounter sometimes an external elastic membrane. So if there's an internal elastic membrane, by the fact of that name, it's telling you that there must be an external elastic membrane. There's an internal mammary artery, you'll find that there is an external mammary artery. Okay? So there we find now that there outside we should have what's referred to as an external elastic membrane. We'll go back and look at that vessel, the one I just showed you, to see if there is an external elastic membrane. But we look at this one here, and this is the large aorta right here. And as I said, we see many replicates of the internal elastic membrane, but not known as internal elastic membrane. Alright? So within the smooth muscle of the tunica media in the elastic artery is very, very large. It's a thick layer, a very thick layer, and a lot of elastic fibers. That's beautiful. Very good. And what am I looking at here? The external elastic membrane. Speak of the fellow, and he appears. That is the external elastic membrane. Okay? And that's a part now, not of the media, but the tunica adventitia. Alright, on the both projecting screens is showing. Isn't that nice, Roy? Yeah. Very good. So that's the external very good. So there we see now the tunica media right here. I just came like that. Look at that, Roy. We're just looking in there. There is the fellow. So this is the tunica media, and you can see right in there that there are many, many of these elastic fibers here. Okay? So therefore, when the blood is ejected from the left ventricle right into the aorta, okay, you get a big bolus of blood, and in systole, when that contracts and that volume of blood is now pushed straight into the artery will now have to what? To expand. Alright, Kim? Alright, so it has to now stretch, undergo stretch to accommodate this large volume of blood. So we need to have an elastic artery. We can't have a muscular artery there, then you'll be in serious trouble. Alright, so there has to be quite a bit of give, and that basically is going to be because of all these elastic fibers. Alright. Now what you see also is that the subendothelial layer is very well developed, because that's where the media is roughly ending, right here. That's where the media is roughly ending. So the media is going to extend from here. Wow, okay. And there is the internal elastic membrane. So the innermost one there is the internal elastic membrane. So this is subendothelial layer. Alright, the subendothelial layer right here, and we can see the endothelium. Now you may wonder, for example, why is this endothelium? What has happened is that a lot of these endothelial cells, because in post-mortem, when we have dissected out the vessel and thrown it now in formaldehyde, the aorta now is going to contract to such a degree that you can see now that those endothelial cells are literally like a little boat full of people, so packed that the people are just falling over the side. Alright? So all these endothelial cells are now literally just standing up. Okay? You see that they look to be nearly vertical. But in real life they were nicely spread out. But now what's happened because of the contraction, the endothelial cells are all piled up like a stack of trees. Okay? So there we see the endothelial cells, but they're flattened nuclei. Notice flattened spindle-shaped nuclei. In some sections where they look rounded, it's the plane at which the vessel, at which the nucleus has been cut. Alright? So it has a nice subendothelial layer there. Okay? Okay, so deposition of, for example, atherosclerosis, etc., where we're going to get a lot of people with high cholesterol levels, etc. That subendothelial layer is going to become very important. Well, I'm no pathologist, but I'm sure you're hearing all of this in your pathology lectures. Okay? But you can see that there is a very, very nice internal elastic membrane right here. That internal elastic membrane is right at the border. Beautiful, very good. That internal elastic membrane that we see right there is just now at the border between the tunica intima. In fact, it's the innermost part of the tunica intima. Okay? So you can see the difference in the subendothelial layer in the muscular artery compared to this very massive elastic artery, which is the aorta. Okay? Outside of that, there we get once again the tunica medium, and in that tunica medium, we're going to find a lot of elastic fibers there running. Okay? So there we get all these elastic fibers there. And let me tell you that very important is that the internal elastic membrane, as you see, has pores or windows, because if it were just a thick sheet, just a complete sheet, then obviously we wouldn't get any nourishment going to the tunica medium. So there needs to be pores in the internal elastic membrane to allow through diffusion of oxygen, etc., to the nutrients to this massive tunica medium. Okay? Now the adventitia here, this adventitia also seems to have quite a little bit of what? Elastic tissue in it. Alright, this tunica adventitia here seems to be having quite a bit of, it's just a mixture of loose connective tissue with an admixture of various types of fibers and cells. But we can see here that it does have also a considerable elastic tissue component. Alright, so let us see if we can find any of the vasa vasorum. We may or may not see them. Okay, but this tunica